Very good. Good morning, everyone. Good morning, and thank you for joining us today on Halloween Eve. I'm Lisa Freeman. I'm the Executive Director of the Louisiana Highway Safety Commission, and I am so proud to be here today with our safety partners from Louisiana State Police, Louisiana Department of Transportation and Development, Our Lady of the Lake Regional Medical Center, and the Safety Place. So we're coming together today for the purpose of reminding everyone of the importance of driving safety, biking safety, and especially pedestrian safety, considering this month of October is National Pedestrian Safety Month. So, on this spookiest day of the year, trick-or-treating should be a light-hearted activity for kids, but unless we are safety-focused, a good time, as we know, can turn bad very quickly. And that's what we're here to put a spotlight on. Before we get started, I would like to recognize some special guests. We have Commissioner Gary Taylor with us. He is on the Louisiana Highway Safety Commission Board of Commissioners. We also have the statewide Strategic Highway Safety Plan Manager, Ms. Autumn Thompson-Goodfellow, with us. Captain Rogelio from the East Baton Rouge Sheriff's Office is with us today. Thank you so much for joining us, and all of our safety partners and sub-grantees throughout the state. Our first speaker is Lieutenant Mindy Keith. She is from State Police. She has been with State Police for 10 years, having served in several capacities prior to her current 2024 assignment to the Public Affairs section. She is a native of Slidell. She holds a bachelor degree in international studies as well as a degree in sociology from LSU. And she also earned her master's degree in criminal justice administration from Loyola University. Please join me in welcoming Lieutenant Keith.
Good morning, everybody.
Good morning.
Thank you so much for joining us today. My name is Lieutenant Mindy Keith, and Halloween is a special time for our children, filled with excitement, costumes, and of course candy. However, it's important to remember that the holiday will bring out lots of pedestrians, and we must remain alert while on the roads tomorrow night. That's why Louisiana State Police, in partnership with the Louisiana Highway Safety Commission, is committed to making this Halloween not only fun, but safe for everyone. For our trick-or-treaters, remember to use sidewalks and crosswalks where available, and to look both ways before and during crossing. Traveling in a group increases your visibility to motorists and adds to the fun. Be sure to stay on one side of the road and walk against traffic if you can. For families, make sure your children are visible in the dark by equipping them with glow sticks, flashlights, or reflective tape on their costumes, especially those that are darker in color. Increased visibility can make a significant difference in safety. Children under 12 should always be accompanied by an adult while trick-or-treating. Even in familiar neighborhoods, having a responsible adult nearby ensures safer street crossings and easier navigation. As parents, take time to review the sex offender registry in your area. This registry can be found on our website at lsp.org. Establish clear boundaries for trick-or-treating, including a defined route and a set return time. For our drivers, Halloween means increased pedestrian traffic, especially in residential areas. Please reduce your speed, even below the speed limit, and be prepared for sudden stops as children may unexpectedly cross the street. Remain vigilant. Watch for children wearing darker costumes that may be harder to see. And be mindful that some clothing or masks may reduce their ability to see you. Eliminate distractions while driving. Put away your phone. Limit interactions with passengers. Stay focused on the road. Distractions can be deadly. Never drive under the influence of alcohol or drugs. If you are attending Halloween events, please plan for a designated driver, rideshare, or other safe form of transportation. Remember, one poor decision can lead to lifelong consequences. In closing, I want to thank each of you for taking these safety tips to heart. Your efforts can help prevent crashes and ensure a memorable Halloween for all the right reasons. Together, we can create a safe and enjoyable Halloween for Louisiana's children and communities. Thank you.
Thank you, Lieutenant Keith. Now we have Adrienne McCrae. Adrienne McCrae, she serves as the Highway Safety Section Administrator at the Department of Transportation and Development. She is a licensed engineer, and she earned her Bachelor of Science degree in Civil Engineering from LSU. In her current role at DOTD, Adrienne oversees the development and implementation of the Louisiana Strategic Highway Safety Plan and the administration of the Highway Safety Improvement Program. Prior to her government service, she worked in the private sector with a primary focus on transportation safety and design. Please help me welcome Adrienne McCrae.
Thank you, Lisa. Appreciate being here. My name is Adrienne McCrae from DOTD. Today we gather to address a pressing issue that affects all of us, roadway safety. As we close out National Pedestrian Safety Month and observe Buckle Up, Bone Down Day, it is crucial to reflect on the alarming trends we have witnessed in Louisiana from 2019 to 2023 when it comes to roadway safety and what we can do to prevent deaths and injuries on our highways. Let's take a moment to consider some of those staggering statistics. Unrestrained drivers and passengers contributed to 34% of all fatalities and 19% of serious injuries from vehicle crashes across the state. Distracted or inattentive drivers were involved in 32% of all fatal and injury crashes. These numbers are not just statistics, they represent lives lost, families shattered, and communities forever changed. Wearing a seatbelt is the single most effective thing a person can do to protect themselves in a crash. It is a simple action that can significantly reduce the risk of serious injury or death. In fact, wearing a seatbelt decreases the likelihood of fatality by 45%. Equally important is the need to combat distracted driving. It is a major contributor to car crashes, and putting the distractions away in the vehicle, like a cell phone, is essential for safe driving and protecting all road users, including our pedestrians. Every text, every notification, every video, all of it can wait. Today, I urge each of you to take the Buckle Up, Bone Down individual challenge by visiting DestinationZeroDeaths.com and click on the QR link code. The initiative embodies the simplicity and life-saving potential of two very straightforward actions: buckle up and keep the phone down. The statistics we've all discussed today are alarming, but we can change all that. We must emphasize the importance of seatbelt use and educate ourselves, our family, our coworkers, our friends about the serious consequences of texting while driving. I also want to highlight the critical role that passengers play in promoting safe driving, including your children. If you see unsafe practices, speak up. Your voice could really save a life. Let us commit to making our roads safer for ourselves and for all others. As we observe Buckle Up, Bone Down Day, let's take the challenge seriously. Buckle up for safety, put that bone down, and something so simple really can save a life. Thank you.
Thank you, Adrienne. Next, we have Dr. L. Mark Lapperouse Jr. He is the Medical Director of Emergency Services at Our Lady of the Lake Regional Medical Center, which happens to be the busiest emergency room in Louisiana. After receiving his bachelor's degree in cell and molecular biology from Tulane University, Dr. Lapperouse then earned his medical degree from the University of South Carolina. He is certified by the American Board of Emergency Medicine, and in his spare time, whenever that is, he enjoys hunting and fishing with his wife and his 4 sons. Please welcome Dr. Lapperouse.
Well, thank you, Lisa. This is an honor to be here today just to speak. What I want to talk about is preventable injuries, okay? Halloween is quickly ramping up to be one of the most busy nights of the year for us at Our Lady of the Lake Regional Medical Center. We are the only trauma center, both for adult and children in the region, and we are seeing a steady increase in the number of avoidable, preventable injuries that come into our emergency department, specifically on Halloween night. Halloween is intended to be a fun time, and it always has been. It's becoming more and more a fun time for adults. And so when there's social outings in Louisiana, as our culture is so rich, we tend to have a little extra fun. And as some of the panelists have already mentioned, these things like alcohol, texting and driving, these things we see increased prevalence on nights like Halloween. So Halloween means something different to myself and my staff at Our Lady of the Lake. We know that there will be injuries coming in, and we're ready for them. But we know that we don't want to see those. We want everyone to have a good time. But with some of the tips that were mentioned, we can avoid some of these things. The things that we're seeing, children, even though we're giving them the best guidance possible, not to run across the street and look both ways, they don't do that because they're excited. And as we mentioned, they're wearing masks, they're wearing costumes, and so they're easily distracted, or they don't have the same peripheral vision that they might if they're on a walk with you on a regular day of the week. So these are some very basic tips of your children are not going to be or are not going to be focused on what's going left and right. They're looking at that next house where they can get a nice piece of candy. So make sure you're close with your children. You're giving them some instruction, but really you need to be their eyes and ears. As far as the adults out there, we understand that this is a very fun night for people in Baton Rouge and in Louisiana. And we want you to have fun, but also you're going to be distracted and you're going to be frustrated. We see road rage because people are late for their engagements. So just understand it's going to take longer, so make some preparations and leave your house earlier if that's what your concern is. We want you to have fun, but we don't want you to be frustrated that there are crosswalks filled with children and other people in costumes. So take your time, be patient, look both ways, make sure that you're looking extra. When you're trying to coordinate with someone, you're looking at your phone and you might be making a text or you're looking at a map. Those are little subtle things that moment of lack of attention, you might not see that person crossing the road. So it couldn't be more important on the month for pedestrian safety. We see many more patients that are walking across streets, bicyclists that are injured and coming into the emergency department. As you can imagine, a car impacting anyone that's on foot or on bike can be very devastating. So as ready as we are at Our Lady of the Lake Regional Medical Center, we don't want to see anyone in our emergency department because of a preventable injury. These crashes on the roads, car on car on pedestrian, they're very severe and they can be lifelong injuries or life-ending injuries. So these are extremely important for us to all be paying attention. We don't want any night of fun in tragedy. Thank you.
Thank you so much, Dr. Blackbruce, for providing that unique perspective from the medical world that you inhabit. Next we have Crystal Pichon, our last speaker. She is the Chief Executive Officer of the Safety Place. Like Lieutenant Keith, Crystal is a native of Slidell. She received her bachelor's degree in kinesiology, health education, and promotion from Southeastern Louisiana University. And she received her master's degree in nonprofit administration from LSU Shreveport. As CEO of the Safety Place, Crystal works to improve the lives of children by empowering youth and caregivers through awareness of injury risks and prevention. Please help me welcome Crystal Pichon.
Thank you, Lisa. Thank y'all for having me. It is such a pleasure to be in such great company with people who are looking to protect our most precious gifts in the community, our children and their families. So Halloween is a spooktacular night. It is made of fun and festivities, but it can also be what nightmares are made of. So a scary statistic is twice as many children are run over by cars on Halloween night than any other night of the year. And the closer that Halloween gets to the weekend, the more dangerous it gets. So with Halloween being on a Thursday this year, we can expect that people, our adults, will play dress up as well. They will take off of work on Friday Friday and enjoy a long weekend. And then next year it will fall on Friday and fall right into the weekend. So we're looking at an uptick in drinking and driving. So we want to give you the tips and the resources and the education that you need to make responsible decisions. So first things first, be seen and see. So make sure that your clothes and your costumes are nice and bright. If your costumes happen to be of a darker nature, make sure that you amp up your costume with that reflective tape, those blinking lights, those glow sticks, and even your trick-or-treat bag, which adults are allowed to have, can be bright in color as well. Parents, make sure that you're supervising your younger children while they are trick-or-treating. And if your kids are mature enough to trick-or-treat on their own, make sure they know the route and they know the rules. Put a tracking device on your child so that you can watch them. Life 360, an AirTag, anything so that you can keep eyes on your children while you're away. Make sure they know no horse playing in the street. Make sure they stay in large groups. And make sure that they follow the rules of the road. Are you looking to trip or treat? We want treats, not trips. So make sure that your costumes fit properly. The eye holes are big enough to be seen out of, and there's enough ventilation so that you can breathe. We don't want anybody passing out. It gets very hot even in October, in November, even though we're in fall. It's easier for a driver to see a child that's right side up on their feet rather than a child who has tripped and fallen in the road. So make sure that your costumes are not dragging too far behind you or they're tied up so that you don't face that tripping hazard. Looking both ways before you cross the street is a normal rule that we hear. Look left and right, but then look left again, because as soon as you look right, somebody's turning out on the left. Driveways cross sidewalks. We tell children, make sure that you're trick-or-treating and you're using your sidewalks, but those driveways that those homeowners are backing out of cross the sidewalk. So where we're telling them to look both ways before they cross the street, they also need to look both ways before crossing people's personal driveways when they're trick-or-treating as well. Make sure that you use those crosswalks and intersections when possible. They are some creepy crawly little creatures, and they will jump out like ghosts from in between vehicles and scare you to death. You have to be alert. So they are definitely not looking for you. They are crawling the streets looking for sweet treats. So you want to make sure that your eyes are up and your phone is down. Before kids cross the street, even if they're in an intersection, you need to make sure that they know to make eye contact with the driver. Usually if a driver sees you, they'll wave you across or they'll give you a head nod. Just because you're in a crosswalk doesn't mean that a driver sees you. So we want to make sure that our trick-or-treaters know how to communicate with people who are behind the wheel of a vehicle. If you will be traveling to take your kids trick-or-treating to some of the biggest and best neighborhoods known for the best streets, make sure that everyone in the vehicle is buckled properly. That's for passengers, adults, children, drivers. If your children are riding in car seats, make sure that their costumes are not too big and floofy and you're not able to get their harness straps and their retainer clip tight enough or in the right placement. So it may be that your child is bare when they get in their car seat and you're dressing them outside of the car if it's one of the biggest, poofiest costumes you could have found on the shelf. And make sure that you're checking those treats. Homemade treats are a risk. Treats that can be easily opened and resealed are a risk. So make sure that before you enjoy those sweet treats, you're checking them to make sure that they are safe to eat and they are safely sealed. And make sure you watch out for those smaller pieces of candy that are chokeable objects for smaller children. And I see this all the time because children they pop the suckers in their mouth. Just make sure that your child's not running with suckers in their mouth, because that ends in disaster. We all see kids running around with suckers in their mouth all Halloween long. So again, it was a pleasure for the Safety Place to partner with these wonderful safety partners. We look for intentional partners that are looking to reduce the injury and death of children due to unintentional injuries in our community. We are doing a wonderful job, but we certainly still have a long way to go. Thank you.
Thank you, Crystal, for all the work that you do to keep our children safe. I think that we can all agree that Halloween should be a fun time for kids to make memories, and those memories should be about costumes and trick-or-treating with friends. And it still is. It still is that for children. But at some point, Halloween also became, as Dr. Laperouse noted, an adult holiday. The National Retail Federation says that Halloween spending in 2023 set an all-time record of more than $12 billion. And that wasn't all spent on Butterfingers and Sour Patch Kids. There are adult festivities at play. And adults are partying. They're spending money on those costumes and relishing the opportunity to take on an alter ego, even if it's for just that one night. But the flip side of the fun time that we see at the Louisiana Highway Safety Commission is that there has been a developing dangerous trend. In the last 5 years, crashes during Halloween have killed and injured more people than during any other holiday in Louisiana, except for the carnival season. Most people don't know that. To put it another way, more people are hurt or killed on the road during Halloween than during July 4th holiday, more than during the Labor Day holiday, more than during New Year's Eve festivities. And that's amazing, not in a good way. And what we know is that impaired driving does play a role, a significant role in this. Since 2019, in our state, 20 people have been killed and 341 people have been hurt in crashes that involved impaired driving during Halloween. So what's the takeaway here? It's simply this, what you have heard from all of our safety partners and our speakers today. If you are drinking this Halloween, do not drive. Do not drive. And just as you've heard, put down the phone. Pay attention to what's going on around you. There are little kids out there celebrating. Little Cinderellas and little Batmen, little Pikachus and Taylor Swifts. Let's make sure that they can look back years from now and think about the fun and the safe trick-or-treating experiences they have. Thank you so much for joining us today and for being a part of this awareness campaign.